Dr. Petti, what do you think about silver fillings versus amalgam fillings? Amalgam fillings versus ceramic fillings. Should people who have silver fillings in take them out? Should they even still get silver fillings if needed to do money or to do whatever? I know you have done a lot of those things.
Yes, they should have them all removed so they can get as much money from the scrap as possible. By the way, folks,
it has doubled over the last few months, hasn't it?
Absolutely. By the way, folks, I'm being sarcastic there. Let me give you my thoughts on silver fillings versus ceramic fillings. First of all, silver fillings have been around for an awful long time. I believe, my history isn't going to serve me 100% accurate, but way in the mid to late 1800s, I believe that they were starting to get products with silver fillings. Now, here's the one thing you have to learn about silver fillings. They're not silver. 50% of that filling material is mercury. Then there's tin, copper, zinc, and a little bit of silver in there. I think the average silver, which is also known as an amalgam filling, is comprised of maybe 5 to 10% silver. So it's called an amalgam, which is an amalgamation or a mixture of different metals, the prominent element being mercury. As a result, I really haven't placed a silver filling in well over 20 years, simply for the fact that today's materials are just as good, if not better, than the silver amalgam fillings, and much, much safer for the health of the patient. The long-standing thought is that amalgam fillings do no harm in patients' mouths. Once the amalgam is set up, the mercury is inert. That may be, it may not be. I think that's up for some controversy and discussion. However, stop and think about this. If you have safer materials to use nowadays, why don't you just use those? I mean, that's what's used in our practice rather than take a chance. There are people that are sensitive to mercury. There are people that are sensitive to other metals in there, and those metals are no good in the body. They do the body no favor. I think a great number of people do, of course, and a great number of doctors do not really put amalgam fillings in anymore. I think that has pretty much caught on very heavy. Now, let's talk about having 4, 5, 6 or more of those suckers in it. Should you go in, drill, and take them out, or is that opening the door to basically spoil the poison into the body and maybe more dangerous than leaving them in? What's your take on that? My take on that is that if a person has some amalgam fillings in their mouth, and the amalgam fillings are fine, meaning they're functionable, they're fine, even though if they've been in there 10, 15 years, they're serviceable. They're doing well for the patient, and the patient has no complaints about the fillings, and they're healthy, so be it. Let those restorations stay. In my practice, anytime a filling is broken, corroded, breaking down, or has what's called recurrent decay, and that's decay around the edges of the filling that are creeping in because the filling is basically shrinking and expanding at a different rate than the tooth structure, then it's time to get those out. And those are the ones that we qualify for fillings needing to be redone. Now, keep in mind that your tooth is not going to hurt when a filling first starts breaking down. It only hurts when the decay and the bacteria get down to the nerve of the tooth. So we try to spot those restorations that are breaking down first, and then we prioritize them, take the worst ones first up to the least worst ones, and get them out of the patient's mouth, and then restore them with the proper either composite tooth-colored filling material or the ceramic inlays and onlays.
Okay. I see. So basically, there is actually not necessarily a reason to just run to the dentist and take out your silver filling. You might go and check them to make sure that they are still intact. And, right. and any normal good dentist will check it, will say, look, they're intact. Leave them in. So that should be the question to the doctor, to the dentist. Look, I'm not necessarily asking should I take them out or not, but more like, are they intact as they're supposed to be intact? And if the answer is yes, then
it's kind of like leave them in. But if the answer is they're starting to shrink, they're starting to be getting little spaces in between and getting wiggly-woggly or whatever it may be, then it's like, all right, it's time to probably take them out.
Right, and the other factor that comes into play is that if patients come in by their healthcare provider, by a physician who really has come to understand that there are some problems with heavy metals in the patient's body, and that these things are not doing them any good, and upon his recommendation, it's like these are probably not doing them any good. We can let's get these things out. Then you can work on a plan with the patient for eliminating that and it's basically for legitimate healthcare reasons, founded healthcare reasons.
Right. So if a physician somehow thinks that there potentially might be something to do with the silver filling, he might be sure about it, he may not be sure about it, but the patient has certain symptoms which at least this wouldn't contribute in a good way, then it may be another reason to, okay, let's get rid of it. It might not do any good to the health, but then again, if it does, you're saving a body.
Well, exactly. There needs to be a proper founded basis for it, and there are many physicians out there who can accurately diagnose if there are heavy metal contaminants in the patient's body. And one of the main areas they look for is amalgam fillings and mercury. So yes, your statement's absolutely accurate, Helmut.
Well, wonderful. Well, I hope this video was informative to lots of patients. I know there's lots of people having questions about it and kind of worrying about it. Well, after they see this, they will, I think, have an answer. Thanks a lot.
Yes. Thank you.